Good evening. The Nightingale Hospital was put up in record time and could have treated as many as 4,000 patients, but it was never really needed because the NHS in London managed to cope with the deadly COVID outbreak. And now, in the next few days, the remaining patients will be transferred to other hospitals as it was revealed the number of coronavirus patients on wards has fallen sharply and the number of deaths in the capital is falling sharply too. Our political correspondent Simon Harris has more.
London's newest hospital only opened for business a month ago. Today's staff at the NHS Nightingale were told their job was done. The patients still being treated are being moved to other hospitals and the Nightingale will be mothballed.
It is the case when the last patient leaves Nightingale this week, Nightingale will go on what's called standby. So if we need it again, it can be turned back on very, very quickly.
It took just 9 days to set up the hospital inside the cavernous XL Exhibition Centre in London's Docklands. But even as it prepared to open its doors, NHS managers hoped the Nightingale would be redundant.
What we really want is for the people of London to not need this facility by staying at home, by washing their hands and social distancing.
The original plan was for 2 wards, each with 2,000 beds. Patients would only be admitted if their illness was so advanced they were on ventilators and unconscious. The Nightingale was created not just to save lives, but crucially to stop other hospitals in London from being overwhelmed. But in the end, the rows of ventilators and beds simply weren't needed, and this giant intensive care unit admitted far fewer patients than expected. In a message to staff, Professor Charles Knight, the Chief Executive, said, "Thanks to the determination and sacrifice of Londoners in following the expert advice to stay home and save lives, we have not had to expand the Nightingale's capacity beyond the first ward."
I think it's a great thing that the Nightingale has been built in order to try and accommodate the worst case scenario, but thankfully we haven't seen worst case scenario and we've been able to manage and deal with response within the NHS itself.
A week ago, London hospitals reported 88 patients with COVID-19 had died in one day. Today, 24 deaths were recorded, bringing the total number to 5,178 since the start of the outbreak. And London now has fewer hospital patients with the disease than the northwest of England.
There are steady but absolutely consistent declines occurring. Possibly in a small number of areas, the trend is somewhat flat. But overall, there are now steady declines in the number of people in hospital. This is good news.
The decision to close the Nightingale is one more positive indicator that the impact of this deadly outbreak is beginning to weaken. Simon Harris, ITV News.
Good evening. In the middle of the coronavirus pandemic, while trying to save the lives of their patients, doctors, nurses and staff at Watford General Hospital must also come to terms with the death of 4 colleagues. One of those was Mo Dibber, who worked as a housekeeper. His son said his father was concerned the hospital was being swamped. Watford General say the death of any member of staff is a tragedy and they will all be investigated. Our political correspondent Simon Harris has this report.
Mo Dibber knew he was vulnerable. He was a diabetic with mild asthma. That worried his family. But he still volunteered for extra shifts on the wards at Watford General Hospital, where he worked as an administrator and housekeeper.
He sort of recognised that, being on the front line was part and parcel of his role, and that anything that he could do to sort of help and support would, ultimately result in more lives saved.
Mr Dibber is one of 4 frontline staff at the hospital to die. Nurse Wilma Banag and 2 healthcare assistants, Khalid Jamil and John Alagos, also tested positive for coronavirus. The local MP works as a volunteer at the hospital once a week.
I know from speaking to the frontline staff, they're genuine heroes. They're trying to save lives and they're doing everything that they can to deliver on that promise to look after the people of Watford and more widely as well. So it really is a tragedy.
Watford General felt the pressure from the pandemic early on. One day in April, hospital managers were forced to declare a critical incident because of problems with the oxygen supply. Some patients were transferred to other hospitals. The town's football club, recognising the strain hospital staff were under, has offered free meals and showers and somewhere away from the wards to relax.
I think my dad had a slight concern in that, it was becoming swamped. And inevitably, it was one of the things that resulted in him contracting that virus.
A pressure group, which campaigns on behalf of doctors, says the deaths are a cause for concern.
I would have a lot of questions about how much in the way of protection those staff have received. And that's not a criticism in any way of Watford General, because I suspect, like all other NHS trusts and healthcare organisations, they've been trying their very best for their staff.
Tonight, a hospital spokesman said, "We are deeply saddened to have lost our colleagues, 4 of whom were frontline staff whose deaths we are investigating." Watford General Hospital has been treating a high number of COVID-19 positive patients since the very beginning of this pandemic. Across London and the home counties, more than 50 health workers have now died. Simon Harris, ITV News.
Good evening. As the capital awaits the details of how and when we will ease out of lockdown, the Mayor today unveiled his plans which could drastically shake up the way we move around the city in future. Sadiq Khan says walking and cycling could be key to getting more people back to work safely, but his opposition disagree. They think his focus right now should be on ensuring that the current transport network is fit for purpose. Our political correspondent Simon Harris has more.
Social distancing and commuting in London. It seems an impossible challenge. This was North Acton Tube Station during this morning's rush hour. Standing 2 metres apart just doesn't happen. And this notorious hotspot underlines how hard it will be to stay safe when lockdown is lifted. City Hall's answer is to change the urban landscape and get millions more Londoners walking and cycling.
We're talking doubling at least of the number of people cycling in London to make sure that this city can work properly.
Not everyone can afford to cycle, not everyone's fit enough to cycle.
No, certainly, nobody is saying this is mandatory or this is the only way to travel around.
The Mayor's plan amounts to a radical redrawing of London's street map to allow social distancing for people walking and people queuing. Parking spaces and traffic lanes will be sacrificed so pavements can be widened. A network of temporary bike lanes will be set up. There'll be one here on Euston Road. And some streets will be closed to traffic altogether. Work has already started. Cars are now banned from Broadway Market in Hackney. Barriers have gone up on Camden High Street to give people on the pavement more room. But the loss of road space isn't appreciated by some drivers.
Basically, this is madness in its purest form. The press release from the Mayor's office this morning says it's going to have no impact on commercial traffic. Really? You're going to take a lane out on the Euston Road, a lane out on the Marylebone Road, the busiest, most polluted road in Europe, and it's not going to have an impact on commercial traffic.
And the Mayor is also facing criticism for not focusing on London's rail and bus network.
So he's got to concentrate on getting the railway network, the tube network, the bus network up and running properly. And if it needs to be that he puts on extra services so that there are less people in each vehicle, then so be it.
Before lockdown, Londoners were making 750,000 journeys by bike every day. If many more cyclists take to the streets during the rush hours, they too could struggle to stay 2 metres apart.
There's going to be a choice. People are either going to get in their car or get on their bike. The more people who get in their cars, the less space there is for cycling, the harder it is to keep that distance between people.
This has been an awful virus. It's been really awful. There are very few silver linings. One of the silver linings may be a way for us to rapidly accelerate more cycle lanes and making it easier for people to walk as well as making it safer.
To begin with, the emergency measures will be temporary. But if the Mayor judges them a success, they'll stay for good.
So, Simon, not everyone seems to be in agreement with the Mayor about those travel plans, but the Prime Minister seems to be quite a fan.
Yes, until someone comes up with a vaccine, life in London isn't going to return to normal anytime soon. And it's clear some politicians do see the crisis as an opportunity to make radical changes to the way we live. And the Prime Minister certainly backs the idea of a cycling revolution. We used to see him on his bike often when he was Mayor of London. But he also suggested the current Mayor needs to do more to make the tube fit for purpose.
A crucial part of our success now in getting transport to run safely will be running a bigger and more expansive tube service so that people can observe social distancing. We will certainly be working with the Mayor to try to achieve that, though there must be, and we'll come to this on Sunday and next week as well, that there must be mitigations to help people who, for those reasons, for the reasons of social distancing, cannot use mass transit, and there will be a huge amount of planning going into helping people to get to work other than by mass transit, and this will be, I hope, I know that my right honourable friend will, as a former Secretary of State for Transport, will agree this is, or should be, a new golden age for cycling.
Simon, not just about plans for the road, but also an update today on air travel as well.
Yes, Heathrow Airport's going to start using cameras which can measure the temperature of passengers. To begin with, they'll be in the immigration hall, so testing passengers who are arriving, not those getting on a plane. And the technology is really being tried to see if it works. But if it does, this sort of screening could become a normal part of the checks we undergo before we fly.
All right, Simon, thank you.